Padme, look at the camera. Oh God.
She's not cute.
She hates it.
She's not
She
cute.
hates it so much. Hi everyone, welcome back to another Mental Health Monday video. I'm MK, your friendly neighborhood therapist. Today I'm going to teach you a skill from a type of therapy called dialectical behavioral therapy, otherwise known as DBT. So DBT is a kind of therapy that is really helpful for people that are extremely depressed, feeling suicidal, maybe dealing with personality disorders such as borderline personality disorder, and things of that nature. Now, DBT is a therapy that focuses on two somewhat opposing ideas. The idea that we need to accept ourselves for who we are, as well as we need to change certain traits about ourselves. I won't be going into great detail about what exactly DBT is and the way it works because there are a lot of different facets to it and a lot of different skills. However, I will probably be referencing it quite often in these videos because this type of therapy gives us a lot of practical skills that we can use to help manage our emotions. So the skill we're going to be focusing on today is called radical acceptance. Radical acceptance is a skill that's easy to learn but very difficult to master. So radical acceptance is something that seems like common sense, however, when you try to put it into practice, it's actually quite difficult. So the concept behind radical acceptance is to simply accept the things that we can't change, accept things that we have no control over, and try to move on from them. Now, many people initially have an aversion to this idea, but hear me out, stay with me, and let me explain a little bit more. So a quote I really like to use when I'm teaching my own patients about radical acceptance is that we do not choose to be in pain, however, we do choose to suffer. What that means is we don't choose for bad things to happen to us, but we do choose to continue to ruminate on them. So for example, if someone broke up with me, I did not choose to have someone break up with me. However, the actions I do afterwards, which might be staying in bed for a few days, watching sad movies, continuing to cry, I am choosing to do those actions which are prolonging my own suffering. Now, an extremely important thing to remember when you're trying to practice radical acceptance is that it's only applicable in situations that you cannot change. So, for example, being stuck in traffic. If I'm stuck in traffic going to work and I'm going to be late, maybe there are some things I should have done, left earlier, things like that. However, now that I'm in the traffic, I cannot change that. And no amount of being anxious or worrying or being upset is going to make that traffic move faster. So that's something I do need to radically accept. An example of something where radical acceptance doesn't really apply is, for example, if you have to take a test at school and you just don't feel like studying. So you just say, I have to radically accept I'm going to fail this test. That does not apply there. There are many things you could do to change the outcome of that, like studying, etc., things like that. Now, whenever I teach radical acceptance to my own patients, I do initially get a lot of pushback because patients tell me that radical acceptance feels like you're just giving up or that you're agreeing that you deserve these bad things to happen to you. So let me be very clear. Just because you're accepting a situation does not mean that you're necessarily giving up or just allowing something bad to happen to you. So one of the principles behind radical acceptance is that until we can accept a situation for what it is, we cannot properly deal with it. So if we keep saying things like, I'm a good person, why is this happening to me, I don't deserve this, we're not accepting the situation for what it is, and we cannot properly handle the situation and then move on. The more I say things like, this shouldn't be happening to me, I can't believe this, what did I do to deserve this, the more that I'm prolonging my own suffering and I'm not accepting the situation and handling it. So acceptance does not mean that you agree with it or that you're giving up on it. It just means that you are accepting that this is your reality right now, there's nothing you can do to change it, and you need to do things to cope with it. So when I'm teaching radical acceptance to my own patients, I urge them to think of something small that they need to radically accept and something big that they need to radically accept. So an example of something small that you might need to radically accept would be if you have a favorite TV show and you're waiting for the new season. You need to radically accept that you need to wait until a certain day to get new episodes of your show. Something big that you might need to radically accept might be things like you're going to have to work for a living, or up until a certain age you have to be in school, things like that. So I wanted to finish off this video by giving you a few examples of things that I need to radically accept in my own personal life. So an example of something I need to radically accept. So last week I wanted to cut my hair short, as you can see, and I thought that I might look good with a pixie cut, and then after I got it cut, I really did not like how short that I went with my hair. So some of you might say there are things I can do to change that, like getting hair extensions or something like that, but that's not an option for me right now. So for now, I just need to radically accept that this is what I did to my hair, and even though I might not like it, this is what I did, and there's nothing I can do to change it right now in this moment. So another example of something that I personally need to radically accept is the fact that I've been sick on and off for the past couple of weeks. So as I said in my last video, 2 weeks ago I had the flu, and then I was okay for a couple of days, and then I got a sinus infection, I lost my voice, and I was really frustrated because I was like, why do I keep getting sick? I need to go to work, I have responsibilities, I need to live my life, and I keep getting sick. And even though I did things in the moment to help myself, like I went to the doctor, I took medicine, I rested, I called out of work one day, there was nothing I could do to really change the fact that I was sick in that moment. And I kept saying things like, why is this happening to me? And I kept getting more and more upset. It wasn't until I said to myself, okay, MK, you need to radically accept that you're sick right now and you just need to do everything you can to get better, that I really was able to relax and rest, and now I'm feeling fine. So thank you so much for tuning in. I'm sorry my videos have been kind of every other Monday. I do intend for them to be every Monday, but like I said, I've been sick and I just need to radically accept that and try to do better from this point forward. So, like, subscribe, comment on things that you need to work on radically accepting. I really appreciate every time I have someone interact with one of my videos. It gives me hope that maybe these videos are helping someone out there. So I will be back next Monday with another mental health video. Thank you.